Cancer Guidance by Type, Part 6. Dr. Dilip Gadgil, Pune. Ca 19.9 is an effective marker for gallbladder cancer or pancreatic cancer, and it is possible to treat and monitor the disease based on this test. We had a case of a 70-year-old patient who had gallbladder cancer, which had led to jaundice and then ascites. The prognosis was that the patient was going to die soon. When he came to me for advice, he had a lot of water in his stomach. The doctors had tried to put a stent inside, but since they couldn't put a metal stent, they opted for a plastic one. The lifespan of this plastic tube was 2 months, but it didn't really matter because they reckoned the patient wouldn't survive that long. I immediately put him on a milk-only diet. The water levels in his stomach decreased gradually and his appetite improved. He could ingest 3 liters of milk every day. He recovered from jaundice and eventually got healthy in general, too. Now, the question was, what do we do about that stent? He was adamant that he didn't want to go back to the same hospital or see those same doctors again. His son was worried about the stent in his stomach and asked me what to do about it. I told him to forget about it for the time being. It could be dealt with later if it became a problem. The patient lived a healthy life for 3 years after this incident. Later, his will to live started decreasing and it led to his death. But the plastic stent didn't do him any harm. So, if treatment is done properly by addressing the root causes, the disease can be managed. It is unfair to say that just because he lived on for 3 more years, we had cured his cancer. But the fact that he lived on healthily after the age of 70 is a definite positive. Learning from such examples and considering all these things is important. The same patient's daughter-in-law had consulted me because she couldn't conceive. She worked in the IT sector, as did her husband, and she had a lot of mental stress and pressures at home as well. I asked her to leave her IT job and she was brave enough to do so. She enrolled herself in a homeopathy BHMS course and completed it successfully. During this course, she got pregnant, too. As her mental stress reduced, she was successfully able to conceive. This is another interesting example and experience. What is also incredible is that an IT professional joins a homeopathy course and becomes a doctor successfully, full credit to her. The fact that gallbladder cancer can be treated or managed in this way is clear from this example.